Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, this is Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. So, we started off our conversation talking about medications used to treat respiratory pathologies, both asthma and COPD. Let's get more involved in these medications to figure out exactly how they work. So, for both asthma and COPD, many patients use a short-acting beta-2 agonist, or what some people call a rescue inhaler, like albuterol, which stimulates the beta-2 receptors in the lungs, producing bronchodilation. Now, of course, a short-acting beta-2 agonist is preferred for the acute attack of asthma because it works so rapidly. It's also indicated for exercise-induced bronchoconstriction, and it's also obviously used for the management of milder symptoms of COPD. Long-acting beta-2 agonists also produce bronchodilation. That would be a drug like Ceravent or Salmeterol, but they're used for the management of chronic bronchoconstriction, or really the management of asthma on a chronic basis, not to be used for acute episodes. So those should stay home. Only the albuterol inhaler should be the one that comes to the office with the patient. These long-acting beta-2 agonists are also used for the management of moderate to severe COPD to prevent exacerbations. Well, adverse effects of beta-2 agonists, whether we're talking about short-acting or long-acting, mean what? Increased heart rate, increased blood pressure, sometimes anxiety, lots of times tremor, and definitely xerostomia because they're stimulating the sympathetic autonomic nervous system. Of course, we recognize that the short-acting beta-2 agonist, so-called rescue inhaler, is again the one that should be available at all times during a dental appointment. However, remember from pharmacology, specifically autonomic pharmacology, that you can use either a sympathetic agonist or in this case, a parasympathetic antagonist to produce the same effect. And in this case, we're going to use a drug called Spiriva, tiotropium, which blocks pulmonary cholinergic receptors and therefore produces bronchodilation as well. Now, Spiriva is indicated for the management of moderate to severe COPD and, of course, the management of chronic bronchoconstriction that's found with asthma. But again, it's not used to treat acute asthma attacks, so leave it home. Okay? Only the albuterol inhaler should be brought to the appointment. Cholinergic antagonists or parasympathetic antagonists can cause things like blurred vision and sensitivity to light. So watch that bright light on the chair and that beautiful bright light between your eyes when you loops. Things like nausea, cough, and even tachycardia. But for the most part, from a dental hygienist standpoint, these drugs cause xerostomia, much like their sympathetic agonist cousins, and may actually produce an altered taste. Plus, sometimes these cholinergic antagonists are so drying that can actually cause a rebound cough. Well, my friends, that's just some of the medications we use in the management of asthma and COPD. Our next episode will be all about more medications that we use to treat both, so stay with me. Another episode coming your way soon. This is Tom Viola with Pharmacology Declassified. Hope to see you soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.